The Roux-en-Y gastric bypass is the most established weight loss procedure around the world, and it involves keyhole surgery, so a general anesthetic, 5 little cuts on the tummy. The operation roughly takes around 2 hours to do, and what's involved is that we staple the top of the stomach to create a little pouch which is roughly the size of my thumb, and then we do intestinal surgery, so we take a loop of intestine and join it onto the pouch, and then we do another join lower down between 2 parts of the intestine. So the effect of the gastric bypass, and this is the traditional type of bypass, is to allow patients to reduce the portion size and again eat a small meal from a side plate. They feel full quickly, but importantly that food is diverted to the lower parts of the intestines, missing the upper stomach and upper small intestine and leading to food delivery to the lower parts of the bowel. The effect of that is the release of a number of very good hormones into the body, such as GLP-1 and PYY, and these are the great hormones that help to give the feeling of fullness after eating. They reduce the patient's need and want to snack and graze between meals, and these are also the hormones which have fantastic effects on medical obesity-related problems such as type 2 diabetes. And in fact, diabetic patients can, for example, come in, have a gastric bypass, and leave the hospital immediately a few days later after the surgery off their diabetes medications, and these are due to the effects not just of the immediate weight loss, which is brief, but as a result of the hormones that are released as due to the gastric bypass. Typically after the operation, which takes around 2 hours, patients will be up and walking within 3 hours of surgery, nursed on specialist bariatric wards. A lot of the surgeons now employ enhanced recovery after surgery protocols, and patients will be able to drink liquids and fluids straight away after the surgery. They will stay in hospital for 1 to 2 nights and go home the following day afterwards. Typically, before a gastric bypass, a patient will be seen by a consultant surgeon in the clinic. Then they will have assessments by a specialist dietitian, a psychotherapist. The bariatric nurse will offer them support. So the whole team from Tonic will be in touch with the patient before and after the surgery to advise about all the appropriate preparations beforehand. Patients will often need to go on a liver shrinking diet, 800 calories a day, low carbohydrate, low fat, typically for around 2 weeks before surgery, but that depends on the patient's body mass index initially. And after the operation, it's a specialist diet to help the healing process, so they'll be on a liquid diet for 2 weeks, pureed blended diet for 1 to 2 weeks, soft, easy to chew foods for 1 to 2 weeks, and then a normal diet afterwards. Following the gastric bypass, the wounds will heal in around 5 days, and most patients will be able to get back to work a week to 2 later. One of the recommendations we make is patients don't do any heavy lifting or get into the gym or do any vigorous exercise for a period of 6 weeks to allow the wounds to heal. After the bypass, patients can expect to lose roughly, on average, around 35% of their total body weight within the first 9 months of surgery, and the bypass will act as a tool to help patients maintain their weight loss in the long term. Because patients will be eating small meals forever, for the rest of their life, they will be required to take a set of multivitamins and supplements for the rest of their life, and these include a daily multivitamin tablet, a calcium vitamin D supplement, an iron supplement, and a 3-month injection from the GP into their muscle. And that's the protocol that patients will need to follow for the rest of their life as a result of the nutritional changes that will occur in the body due to the gastric bypass.